Let me begin by appreciating LASHMA again for bringing this together. All critical stakeholders required for Lagos State to achieve universal health coverage in record time. I have been privileged to attend 3 engagements of this nature at this venue. One was to sensitize members of my own committee, House Committee on Health Services, on the Lagos State Health Scheme and the activities of LASHMA. While the 2 others, including today's retreat, are focused on enlightening our local government chairmen. This demonstrates the importance that Lagos State places on continuous engagement and capacity strengthening as we deepen the implementation of health reforms. I urge our Conference 57 to take this retreat very serious. As leaders at the grassroots, we play a pivotal role in translating government policies into tangible benefits for the people. It is your responsibility to ensure that residents in your respective local government and local council development areas enroll in the social health insurance scheme, and that the vulnerable within your communities are identified, supported, and provided access to equitable and quality healthcare services where possible. Let us sponsor the vulnerable by paying their premiums, and where challenges exist, let us work closely with the agency to develop sustainable solutions, as the inclusion of the vulnerable remains a collective responsibility. This retreat therefore provides an invaluable platform to identify challenges, share practical solutions, and align strategies that will strengthen healthcare delivery across all local government areas and LCDAs. Once again, I commend LASHMA for its sustained efforts in expanding health insurance coverage, implementing impactful initiatives, and continuously engaging stakeholders in this important journey.
The executive order signed by Mr. Governor on the 16th of July 2024 is not merely a policy directive. It is a bold reform aimed at guaranteeing universal health coverage for all residents in Lagos State. It represents our collective commitment to ensuring that no resident is denied access to quality healthcare due to financial constraint. So the success of ILERA EKO depends significantly on leadership at the grassroots, which is where you come in. Local government are the closest to the people and are uniquely positioned to drive enrollment, mobilize communities, and ensure residents understand the benefits of the scheme. You are therefore encouraged to ensure full enrollment of political office holders, local government staff, ad hoc employees, and community members within your jurisdiction, while also promoting utilization of the scheme. It is also imperative that ILERA EKO advocacy becomes a standing agenda in community engagements and town hall meetings with primary healthcare centers serving as access points for beneficiaries. Equally important is ensuring coverage of vulnerable population and monitoring compliance among businesses and organized private sector entities operating within your local government areas. Let me emphasize that the executive order is enforceable. While government will continue sustain public sensitization, compliance is not optional. It is statutory obligation aligned with our vision for universal health coverage. Healthcare financing reform remains one of the most effective tools for poverty reduction and social stability. When residents are protected from catastrophic health expenditures, families are preserved, productivity improves, and the state economy grows stronger. I therefore urge all the local government chairmen and LCDA here present to become strong champions of ILERA EKO within your communities and jurisdiction. With your leadership, achieving universal coverage across Lagos State is not only possible, it is within reach. ILERA EKO is the most robust health insurance facility in Nigeria by far, being 100% better than the closest state. We must commend the Lagos State. We are always the best in everything that we do. On behalf of the Lagos State Public Service, I reaffirm our unwavering commitment to full implementation of the executive order and continued institutional support to LASHMA in achieving the objectives of ILERA EKO.
So what we're doing here today is trying to advance a healthcare financing reform strategy where we make it more possible for the hospitals and the clinics to receive payment for the services that they're delivering, rather than relying on out-of-pocket payment, which is the norm at the moment. You all know, because many of you reach out to me and say, my patient is in one of your hospitals and they've given them a bill of X amount. We can't afford it. Is there anything you can do? Unfortunately, somebody has to pay for the services. And if we keep writing off bills, that scenario is no longer sustainable. So the idea really is to find a means by which our citizens can pay for health. And the option of paying out of pocket is the least desirable because it drives our citizens into poverty. If you are unfortunately sick, and we never pray for sickness, but it happens, it takes you by surprise, and you are suddenly labeled with a bill that you cannot afford. You now call your relatives, you call the commissioner, you call the head of service, you call the DS, you call everybody, you even call Honorable Musiba to come and help you. But that's not the way we want to continue. We want to continue by establishing a well-structured health financing mechanism. And so, enter the National Health Insurance Authority Act of 2022, where President Buhari released a law that says it is now illegal for Nigerians not to have the basic form of insurance with what we call social health insurance. As soon as that law was released 4 years ago, Lagos was extremely fast to domesticate that law. Therefore, now illegal for Lagosians. If you live in Lagos, you work in Lagos, your living is made in Lagos, it is really your responsibility now, according to the law, to have the social health insurance in your pocket. So what is happening now is that in Lagos, we're making it fairly compelling that each and every Lagosian should carry health insurance. Either you pay for it yourself, and if you can't pay for it yourself because you're living below the poverty line, then Lagos State government will rise to the challenge to support our vulnerable by paying for health insurance for them, which we do through various mechanisms, including the equity fund and certain other activities that we're about to start. I think we are sharing the responsibility with you this morning that it is not just federal government, it is not just state government, but it is more importantly local government, because you are at the grassroots level. That one, we continue to work together to make sure the facilities are up to standard, but number two, that we encourage our citizens to take up the social health insurance so that they can pay for services not out of pocket, but out of the funds that come from the pooled bank of resources that happens during insurance. So on that note, I'd like to congratulate the agency LASHMA. You've done a fantastic job promoting the executive order, activating the teeth of enforcement, and on this occasion, bringing very busy executives to this meeting. Thank you very much. This is really a very, very important meeting, and I wish you happy deliberations. Thank you so much.
I also welcome all our 57 chairmen of local governments and local council development areas to this one-day orientation retreat on Lagos State mandatory social health insurance. Let me begin by sincerely thanking you all for honoring our invitation. Your presence reflects a commitment to the well-being of our people at the grassroots, the very foundation of governance. And permit me to cast our minds back to September 2024, when LASHMA convened a similar retreat at this same venue. Between then and now, some chairmen have completed their terms, while others are serving second terms and some are newly elected. I congratulate you all and commend your willingness to continue this historic journey towards universal health coverage in Lagos State. In local government areas and local council development areas, they remain the closest tier of government to our people. So you are the first point of contact on issues of welfare and development across the state. And as chairman, you are not only administrators, but custodians of public trust and champions of community advancement. Distinguished guests, ladies and gentlemen, the Lagos State Social Health Insurance Program, popularly known as ILERA EKO, this was established to ensure an accessible, affordable, quality healthcare for all Lagos residents. Under the visionary leadership of our governor, Mr. Babajide Sanwo-Olu, the scheme continues to expand. However, to achieve universal enrollment, this requires your active leadership at the grassroots. Globally, healthcare financing has shifted from out-of-pocket spending to structured insurance schemes. So Lagos State must continue to lead this transition, particularly within the informal sector, within the artisans, market men and women, the youth, CDAs, community development associations, and community development councils, and all the vulnerable population. Your role is therefore pivotal. As executive chairman, you have the platforms and influence to integrate ILERA EKO advocacy into community engagements, to leverage world structures for mobilization, to support compliance with the state's health strategies on insurance framework, and lastly, to identify and sponsor indigent residents within your communities. So experience has shown that when local government take ownership, enrollment increases. When leadership speaks, clearly community respond. So the success of ILERA EKO at the grassroots depends largely on your mobilization capacity, your political will, and sustained engagement at the grassroots. So universal health coverage is not just a policy now, it's a moral responsibility to ensure that no resident in Lagos suffers financial hardship due to illness. Today's retreat has been strategically designed to deepen your understanding of ILERA EKO, the operations and its benefits, to clarify the roles of local governments, areas and LCDAs in driving enrollment and compliance, to strengthen collaboration between LASHMA and the 57 councils, and lastly, to develop practical and measurable implementation strategies at the grassroots. So I want you to view this engagement as strategic, an opportunity to align all our efforts and reinforce our shared commitment to improved health outcomes across Lagos State. So LASHMA cannot achieve this alone, so we are depending on your cooperation and partnership at the grassroots to enforce and encourage mass enrollment. So the realization of universal health coverage requires coordinated action. State and local governments, traditional and religious leaders, community associations, youth groups, and civil societies. So, this retreat signals a renewed phase in grassroots-driven implementation for the common goal. Having commenced the enforcement across ministries, departments, and agencies, the next focus is the informal sector, where your leadership will be decisive. I encourage us to live here today with a renewed commitment, clear targets, and actionable plans. Following this retreat, LASHMA will then engage each local government area and LCDA to assess progress in implementing the executive order signed by Mr. Governor July 16, 2024. Please, let us remember, the health of our people is the wealth of the state. Our healthy population is more productive, secure, and prosperous when they have good health. So once again, I warmly welcome all of you and urge your active participation, honest feedback, and firm commitment to advancing ILERA EKO within your jurisdictions. So together, we can ensure that every resident of Lagos State has access to quality, affordable healthcare without financial hardship. So I want to thank you for your partnership and dedication for being present, and I wish that God bless all of you, and want to enjoin you to know and believe that ILERA EKO, thank you very much.